Hello and welcome to CDC Profiles. Our featured speaker for this episode is Dr. Benigno Agbayani Jr. Hello, Doc. Good to have you.
Hi. Hi, Mari.
Doc, can you
Thanks
just
for having me.
can you share with our audience lang a little bit about your medical background?
I'm an orthopedic surgeon by profession. I practice at Manila Doctors Hospital. I'm the chairman of orthopedics there. And I've been in practice for around 20 years as an orthopedic surgeon, and I specialize in arthroscopy and joint reconstruction.
What is that, Doc, if you don't mind?
Arthroscopy is basically the small hole operation where you reconstruct joints like the shoulder, the knee, for especially for sports injuries like ACL tears, and I do a lot of joint replacements like knees, hips, elbows, and shoulders.
And do you have a current focus or practice? Is gardening is obviously one of them?
Well, I'm actually a person who is very much aware of what's happening in the society. So I'm always involved in some of those awareness campaigns which regards to, for example, smoking, sugar, and how bad it is to our diet. And I was, before this COVID thing happened, I was sort of a major proponent of low carb, high fat diet and
Speaking of
intermittent
COVID,
fasting.
speaking of COVID, Doc, what was your initial reaction when you first heard about COVID?
Well, this is what happened to me. I heard about it around February, but I thought it wasn't going to arrive in the Philippines. But come March, my anesthesiologist, Dr. Romeo Makasay, was one of the first ones who died among the doctors, and he was really my regular anesthesiologist. We would see each other every day. We spent time together at the operating room. So when I heard he got the virus, it actually scared me somewhat. So,
How
so that's
old?
how it.
How old was he, Doc?
That's I think he's around 62.
So he's not quite in the high risk category yet, would you say?
Uh, he is because he already had a heart
Oh,
operation.
okay.
So
So, have you yourself treated any patients with COVID, Doc?
no, actually, I haven't formally treated the patient with COVID, other than using it myself. I treating myself for some prophylactic treatment. Occasionally, I get questions about it, but no, I haven't really treated the patient with COVID.
So this kind of contradicts what others have been saying that there is no prophylaxis for COVID. That you are taking a prophylaxis, and what is that?
I did take it when I thought I was really in a high risk state. And also, I really felt the danger was so high with me being in the operating room a lot. So I took hydroxychloroquine.
Doc, we're talking about you've had extensive medical education and you've been in practice, you said 20 years, and yet you took hydroxychloroquine, which many are now saying is a dangerous drug. Well, some are saying is a dangerous drug. It's not a dangerous drug?
Definitely not a dangerous drug. I think it's been in the market for 40 years. It's being used as a prophylactic for malaria, and is being given left and right to travelers to places with high malaria rates. So it is definitely a safe drug. So I wasn't afraid to take it at the right dose.
So what would explain the comments now that we're hearing nowadays that it is that it is a dangerous drug? It will cause arrhythmia. It will cause all kinds of side effects.
Uh, my experience with these things, this news coming out, is that sometimes there's a motive to it. Uh, of course, not everyone who is putting out these data has a motive, but if there's so much noise coming out from the media about its safety, in my experience, something or someone is behind it to debunk or to lessen the if the the benefit of this drug, to lessen the impact, so to speak.
Doc, from previous conversations I've had with you, you've mentioned that you went into extensive study on COVID over the past few months. What have you learned?
Yes, it was so strange because if you're a busy doctor, You spend practically 7 hours a day working, seeing patients. So when suddenly I had to stop, I spent around 5 hours a day studying COVID, and it's not just watching the news. It's really looking at the latest scientific studies from day one that I stopped working. So it's a lot of study. I wake up at 4 a.m. I'd read until 8. Then I do some exercise, and then I study again at around 11, and then finish up at around 4 p.m. and do some exercise. And that's what I was doing for the first 3 months.
And from what you learned, are you more terrified of COVID than before, or are you less terrified?
Definitely less terrified. You know, the unknown is nothing more terrifying than the unknown. And an initial data that came out, or at least the initial news that came out, was that this is a very dangerous and lethal disease.
But that's not what you found.
Definitely not. I think data started to come in even as early as late March, then April. Many scientists already came out with their declaration that this is definitely not as dangerous as Ebola, or the one that they had predicted earlier, where they said millions would die. I think the number that they were giving early March was 3.4% mortality. So around April, I think people already knew it wasn't 3.4%. Definitely much, much lower than that.
And yet we've persisted apparently under the thinking that it will kill 3.4% of the population, apparently.
Yeah, I think it seems like we forgot about it. That the reason this lockdown was started because of that notion that is a very deadly disease and that we should lock down. And apparently nothing else can stop it but to lock down. I was even telling my friends then that the Philippines will be very much in trouble since we didn't have enough ICU beds, we didn't have enough isolation beds, that just a few hundred patients would overwhelm our health system. So I was very scared, and I was actually telling people to be scared because I don't think the Philippines was ready. But lo and behold, come April, that wasn't happening. I was saying, where is it? Where is the overwhelming numbers of patients crowding the hospitals? Even the Philippine General Hospital, where I have lots of friends, and where my hospital is beside, where Manila Doctors is beside Philippine General Hospital, we were amazed that Manila Doctors is already full, and yet Philippine General Hospital wasn't even half full yet. So there's something going on. Apparently, people would go to the private hospitals, and later on they consider the public hospitals.
So, Doc, if scientists knew as far back as April, you yourself knew as far back as April, what explains why we continued under lockdown that was premised on the 3.4% death rate until now in mid-October? Until now in mid-October, we're still under lockdown. What explains that?
Yeah. I think we've been addicted to this to this lockdown thing because it's like a promise of safety that because of lockdown you are not dying, because of lockdown we're not seeing the numbers that was expected. So when they say like I think there was a prediction of 3.4%, so 3.4% in the Philippines, that's like 3 million, right? So
3.6
so they're
million.
say so they're saying the lockdown is preventing us from getting to 3.6 million. So how do you get out of it? That was the problem.
So why did they not find a solution when other scientists all over the world?
Yes.
Anyone can Google and find that, but why didn't
Yes,
they?
as you did, as I did, as many people did, who are quite aware of it now. It's just so strange that, but that still goes on. You know, it feels like it's so easy to fool the Filipino people. Um, I think I already knew that it was already wrong as early as the first week of April when I saw the following people on YouTube, on the news, like Jay Bhattacharya, like Ivor Cummins, of course, Professor
Sunetra Gupta.
Michael Levitt,
Right.
Sunetra Gupta. These are not, you know, weirdos or crazy people or fringe doctors. These are highly respected doctors telling us the actual rates, the most likely number of fatality rates. So it was good news, and it was real news. So it's something that a lot of people should have known, and I'm amazed that despite the number of good doctors, great doctors in our government, such news don't seem to reach them.
What would you suggest to government as a solution, Doc?
Well, right now, I think the most urgent thing to do is first recognize, or at least let them know if they don't know of this information that we all practically know in our group, the concerned doctors and citizens of the Philippines. Of course, it's just assuming that they don't know, but there's certainly we have the duty to let them know what we know. But once that is done, the first order of things to do is to lift the lockdowns, but to lift it in a safe and rational way. And quite recently, there's already a big group of very prestigious, very uh, recognized epidemiologists and public health officials who are giving the option of what to do if you're getting out of a lockdown, and that is the Great Barrington Declaration.
The focus protection plan. Would you be able to
Yes.
delineate some of the points of the plan?
Well, I'm not the author of that,
Right.
but I think basically you in one word, it's the very selective protection of the highly vulnerable people, and these are the elderly, and of course those who are immunocompromised. So the plan basically is protect those who would likely die from COVID, and let the people who are healthy, the young people whose risk is really very very low, to go out and work and mix it up, and shouldn't be restricted whatsoever. So basically, that's what should happen. But because we are coming from a lockdown, we might have to do it in a manner that is gradual, and certain protocols have to be in place. Because another factor that's often forgotten is our health system capacity. Although I think we much improved over the 6 months, we still have to be aware that we're not the same as the first world countries, and I understand that too.
Of course. Doc, when you share your perspective with your fellow doctors, what kind of reception are you getting?
Funny you should say that, because a lot of my friends think I'm crazy. So, but I do have a reputation of going against the grain. I actually welcome that I don't follow the tribe, so to speak. I use my own thinking. I'm an independent thinker, so I don't really mind what they say. I think in the end, the truth will come out that these are the things that I'm saying are based on facts, on good information, and like you, like any individual who at least has access to the internet would know that this to be true. Why we seem not to want to listen to it and want to just let other people decide for ourselves is something that is I think the main reason we are still in this quandary.
Okay. Doc, if there are any other doctors who are watching us right now, what particular references would you point them to online? Do you have any?
Oh, actually, my favorite reference is actually Ivor Cummins. The other one is
YouTube.
in YouTube, because it's easy to share, easy to understand. He cites data, he cites evidence, but certainly there are many out there already, like Senator Gupta, Jay Bhattacharya, who has been sharing this information since April, and I
Correct.
think you've seen them as well.
Right.
And I this is so strange that I was actually sharing their sites, their information to my friends, but I realize now that they didn't even bother to watch them or read them. So it's a bit sad.
Yeah. Any good news that you can share to end us on a happier note, Doc?
Well, good news. I think things are falling in place. The Great Barrington Declaration is one of the best news in my life. Uh, it actually felt like I'm vindicated. It,
True.
it, it, yeah. And that night I couldn't sleep from joy, actually, of thinking that I am not alone. That feeling that I am not alone. I'm not some kind of idiot just telling my doctor friends about these things that I know. So yes, there's good news. Apparently, the scientists, the real scientists, are speaking out, and the WHO seems to have caved in
Right.
because they already have they made these statements saying that lockdowns are just stopgaps. It should not be something that we should be using until
Okay.
now.
Correct.
So to me, that's almost victory. But I understand that our country still is not in that kind of mindset yet. And I'm hoping to share that mindset of knowing the facts, knowing the information about this disease. We shouldn't be as afraid as we were. We should be cautious, but not afraid. We are getting to understand this disease much better. I'm hoping that my friends in epidemiology, in public health in the Philippines would join us and believe that the cause is for the Filipino people. It's not just for my ego or just to prove that I'm right, but that we're here to help our fellow Filipino people.
All right. Orthopedic surgeon Dr. Benigno Agbayani Jr., thank you, sir, very much for your time.
Thank you. Thank you.